if you've ever had your heart broken, then you know it's just this indescribable pain, and it can go beyond emotional damage. Cardiologist, psychotherapist, and author of Heartbreak and Heart Disease, Dr. Sinatra, saying a big breakup isn't the only event that breaks hearts. In fact, quarantine, the pandemic, it's all been a big contributor too. And he's joining us live this morning. Good morning to you, doctor.
Oh, it's great to be here, Netta.
So let's talk about our hearts. I mean, a lot of us have gone through so much stress and sadness, especially this past year. So what is your concern here as far as what we've all been dealing with through this pandemic?
Well, the pandemic is very uncertain. In other words, it causes a lot of vigilance. And vigilance is like waiting for the other shoe to drop. I mean, people are locked in their homes. They can't go to restaurants. Children aren't playing sports. I mean, everybody's confined. Anger seems to increase. Suicides are going up. I mean, it's just incredible. And hopefully, with the vaccination situation, coming to fruition, hopefully we can all get back to a normal routine. Because once our normal routines are just, thrown in the gutter, everything breaks loose. And unfortunately, illness prevails. And I've seen it happen many times before in other situations, especially during wartime, like the Vietnam War, where I saw a lot of sudden cardiac death. And it's almost like the same situation. So something's got to give, and hopefully things will get better. So I am optimistic.
It's hard to describe, but I think a lot of people know that feeling just when your heart hurts or it feels like it's just sunk low. I'm not sure how to scientifically, obviously, describe that, but that feeling of it getting hopeful or rising a little bit, just lifting up a little bit, obviously makes a huge difference in just how we approach life and, just overall feelings. But what you're saying is that feeling is also impacting our health in other ways, right?
Oh, absolutely. When you have heartbreak, Netta, you have deep sorrow. And sometimes you get, very depressed. And the thing with heartbreak is it's literal and also figurative. Mm-hmm. And when heartbreak occurs, the deep sorrow and sadness that accompanies it sometimes can be overwhelming. And the best remedy, if you're suffering from feelings where you had a breakup of a relationship, or you lost your job, or you're confined to your house because of the epidemic, the best thing to do is to get into your sorrow, feel your symptoms, feel your depression, and crying is the best remedy that I know of to release the heartbreak that won't lead to heart disease. So getting into your tears, getting into your deep sorrow is the antidote, and I recommend it to anybody, especially during this time.
This, may sound a little, I don't know, hippie, if you will, of me, but there's some yoga poses that just make me break down and cry. More so in the past few months, just after all the things we go through, it's like these emotions just come out. But afterwards, I do feel a lot better. My heart feels lifted.
Absolutely. When you cry, you're not only releasing endorphins in your tears, which is actually the feel-good type of hormone that get released, but when you cry or sob, you're releasing chemicals in the lung, which actually has an impact on improving blood, fragmentation in the body, so the blood doesn't clot. We call it thromboxane A2, for example. I mean, that's the scientific term. But yoga is great. And, one of the things about yoga is that when you put yourself in certain poses and you create a lot of stress and tension, or twists, or let's say a cobra position, when you do these situations, and if you can breathe into the twist or breathe into the uncomfortableness, that in itself is very good for releasing locked in stress and tension in the body. So I'm glad you brought up yoga. It's a good point.
A medical professional prescribing crying to help with heartache. I like hearing that. So you're a cardiologist, a psychotherapist, and certified nutrition specialist. Tell us about that. How does all of this come together?
Well, in other words, one thing about heart disease, it's multifactorial. The brain affects the heart, what you eat affects the heart. So over the time, I just became certified in so many different specialties, and nutrition is important. People don't realize it, but let's face it, in this country right now, we have almost 100 million diabetics, whether they're type 1 or type 2 or insulin resistance, it doesn't matter. But diabetes is a horrific comorbidity for COVID-19. So it just makes sense to eat less sugar in our diet, eat more omega-3 essential fatty acids. In other words, eat the things that can make us feel good. One of these fats, for example, is DHA. We call it docosahexaenoic acid. It's found in fish, migratory fish, salmon. You're on the West Coast, so migratory salmon would be very good. It's also found in chickpeas and certainly garlic and onions can help thin the blood. There's so many different foods we can use. And some of my favorites, by the way, are artichokes. I mean, I love artichokes for supporting the liver, and avocados as well, because they contain these monounsaturated fats. Even olive oil. Olive oil is fantastic because it's the secret sauce of the Mediterranean diet. And remember, Netta, the Mediterranean basin has the largest number of 100-year-old pluses in the entire world. It doesn't make a difference whether you live in Greece, Turkey, Libya, or Spain or Italy. There's so much longevity in that basin. And the feeling that researchers believe in is that olive oil is the secret sauce because of the fats again. It's the fats in olive oil that bring, wellness to the table.
Drizzle that on everything. Okay, drsinatra.com. That's your website, Heartbreak and Heart Disease. You have many books out. Here's the latest one, and this could help a lot of people right now. Thank you so much, Doctor, for being on with our show. We appreciate your insight.
Thanks so much. Thank you so much.